Hello, everyone. It's Friday, May the 8th. We've got one really good thing to report. Well, I hope several things, but the first thing that's the most important to me is we've not lost anyone since the last time I was here, which yesterday, and it doesn't sound like much, but if you'll follow the other states are losing hundreds a day, and every time we lose one, it's not good. We've still lost 51 people total. I'd ask you again to please keep those people in your thoughts and prayers. Yesterday was a really important day, a national day of prayer, and so, you know, I'm sure those families and those people, those great West Virginians we lost, appreciate you. I'm not going to read you through what's happened in week 2 and week 3 of our reopening plan will begin this coming Monday, and guidelines for those businesses are up on our website. Week 4 will begin Monday the 18th, and we will announce business reopenings for week 4 next week and provide guidance at that time. I promised you today that we would give you guidance and a date on the Hatfields and McCoy Trail. You know, I've gotten an awful lot of feedback from a lot of different people, from our tourism people to our medical experts to people in other states, and we've weighed a lot of different factors. We know how important the Hatfields and McCoy's trails are to us economically in the southern end of the state. The biggest thing that I think we can do is just this, is I think it is an outdoor activity. I am absolutely aware of the fact that people from out of state come here and enjoy those trails and everything, and as well as our people within our state. And I am recommending that, or going to move now, that we open the trails on Thursday, May the 21st, before Memorial Day weekend. And today, as a part of my West Virginia Strong, the comeback reopening plan, I am announcing that. And but you know, there's going to be limitations, and we're going to enforce the limitations as best we possibly can. And the limitations, you're going to see, they're going to put them up right there, and I'm going to read through them because I'm confident that we can do this. But riders are encouraged to wear face masks or face shields while stopped. Now, all riders by law must wear a helmet while riding. Self-screening. Riders are encouraged to self-screen for COVID-19 symptoms and guidelines. Temperature checks. Riders are encouraged to check temperatures and everything. If temperatures are over 100 degrees, the riders are not permitted to enter the trails. Sick riders of any kind, we will remove and ask them to remove themselves immediately and go home. On the limit of grouping, riders are prohibited from congregating along the trails. Physical distancing. Practice proper social distancing at a minimum of 6 feet while practical and safe to do so. Shared vehicles. Riders are discouraged from sharing a vehicle, you know, with anyone outside their immediate group or party. And shared equipment. Riders are discouraged from sharing safety equipment or masks. Now, the bottom line to all that is just one thing, and it's just as simple as this. Anyone that's coming to our trails, we expect you to respect us and respect our people that are here, and protect yourself, but protect us. And we will watch this, and we'll watch this like a hawk to the very best of our abilities. Now, there's no question that there's some people that are going to mess up and everything. But I think absolutely an outdoor activity such as this, and we have got to remember we cannot stay closed forever. We've got to try to reopen as we go forward. We've got to understand we have got to some way, somehow try to live with this pandemic and this disease as we go forward. We cannot all as a nation just draw in and stay at our house as a nation for months, because what will happen is just simply this. We will slip into the awfulest depression that we've ever seen. And if we slip into that, there will be food shortages. There will be neighbor against neighbor. Many of us have lived through that depression, the last depression. I didn't. My parents surely did. And absolutely, there's still people out there that did live through that depression, and they know what it was all alike and everything. And so if in fact we think the best thing is not reopen in any way and just stay at home, absolutely, you can't do that forever. And absolutely, West Virginians know how to protect ourselves. All the people that have businesses or cabins or anything or whatever it may be, follow the guidelines that are already out there. I've said it and said it and said it. And absolutely, cleanliness has got to be supreme beyond belief. People that are out in public and everything have to wear masks, we highly encourage them to wear masks and everything. Let's just continue to do what we've already done, West Virginia, and be smart. I truly understand there's two sides to this coin. It's a difficult decision. Anything we do is a difficult decision. I mean, it is as simple as I've said over and over. On this left hand, you've got risk. On this right hand, you've got the possibility of an all out and out depression. Now, and somewhere in between is where we've got to land. And this is what we've got to do. And we've got to protect ourselves as best we possibly can, and we're going to do that. We're going to protect you, whether it be in McDowell County or wherever it may be. We're going to protect you to the very best of our abilities. We're going to be ready to take over a situation if it gets bad, if we have some kind of outbreak or whatever, but we're going to protect you. But we've also got to recognize the economic benefits of what we've got to do, and we've got to absolutely recognize we've got to move north. We have got to continue to move forward. And so I ask you to try to help and participate, and I am happy about reopening the trails, but I'm also concerned. And so I'm gonna just leave it at that, and we're going to monitor in every way. And I hope that each and every person that is on those trails or in our buildings or whatever it may be, respect every single thing about the great values of West Virginia and what we've already done. We'll watch it as best we can, and if we've got to stop or we've got to back up or slow down, we'll do any one of the three. Now, if I could just report real quick here on our numbers today. Our numbers look even better. Where we spiked up there and just a little teeny bit above our trend line on one day, we had a 3.1. We're back to where yesterday we had a 1.8, which is really great. Our overall cumulative to positive test is now 2.20. Unbelievable. That's the lowest it's been. As far as our active cases versus our recovered cases, you can see the blue line is the active cases that we're treating, which is somewhere it looks like around 488 or something like that, and the orange line is the cases that have recovered, and they're now somewhere around 740. So we've got 488 we're treating and 740 that have recovered, and that's the way we want it to do. We want it to continue to just widen and widen and widen, where the blue line goes down and the orange line keeps going up. we have now tested in West Virginia 3.3% of our population. The closest state to us is 2.4, and that's Maryland. You know, Pennsylvania is at 2% flat. The nation is at a pace of 2.4, and we're at 3.3. So we're testing significantly more of our population than the nation as an average or any of our surrounding states. We're going to continue to do so. We announced yesterday that we're putting out an order to test all the assisted living places and the daycares, and we're going to just continue to test more and more and more and stay on top of this in every way and still try to ease us back with baby steps into a reopening. And so I hope we'll celebrate the fact that we're moving back in southern West Virginia to opening our trails, but we've got to be really careful. And now, if I could just touch on just a couple other things real quick. I have a note here on city and county guidance that we have been in constant communication with all of our cities and counties and the associations that represent them. I know they need our help. By next Friday, guidance will be available on the website for cities and counties to use to apply for money from the CARES Act. And the only thing I would say on that is don't hold us concretely to a date, because I was told last night that you know, even though that the House is going to come, from our congressmen and women, they're going to come back next week, but it could be that they'll drag into the early parts of the next week before we have the absolute guidance as what we can do. The only thing I want to add is every day I encourage you more and more and more about the census. Make sure everybody's counted. That's a pretty simple thing to get more and more dollars to the state of West Virginia. And if Jordan, if you all put that up on the website one more time, you know, that's all you got to do. And just follow the guideline there and just get counted, please. But that's all I've got for today.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. A couple things we'd like to highlight today. First, work going on today with Toyota Manufacturing and the National Guard related to training for PPE, sanitization, spacing activities as they begin to go back to production next week. Also want to thank Toyota. They have made and donated over 32,800 face shields during this downtime from production. So thank them for the great work to help protect our first responders and our frontline medical folks. I want to highlight on the stabilization of population issues. We continue to have great success with the work of our food bank, our volunteer folks at VOAD and the various organizations, as well as the school feeding program and our workforce efforts. While I understand that, and we understand that we may have had bumps in the road in some of these various activities, I think if you look across the nation right now, West Virginia is doing a very good job of meeting the governor's objective of stabilizing population and working with our citizens to make sure that they're taken care of during this difficult time. Last two things I'd like to highlight relate to the military and the National Guard. Today is Military Spouse Appreciation Day, so I want to thank my wife and all the other spouses of military members. Our military families sacrifice more than any of us in this country, and I want to take this time to thank them. And also today is Victory in Europe Day. I know Governor Justice had a father who was a member of the Army Air Corps and a flyer during the war. And I want to just put in perspective for those of us, and we're going through challenging times. I know there are children that are struggling with not being able to graduate in a normal sense. But I think back of my grandfather, who was the father of four, who left at the age of 35 and went off to war during World War II, and my uncle, who left before graduation and went to war. So we want to thank all those military World War II veterans who are still with us today, and their families and thank them for the sacrifices they've made on behalf of our nation. Thank you.
Thank you, General. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. I want to say that Sunday is Mother's Day. This is a great opportunity to thank your mother for those times that she's been there for you and recognize her role in our lives. You may be wondering how to celebrate Mother's Day in the midst of this pandemic, especially those mothers who are at high risk and who are high in age. While it is critical to continue following the guidelines of good hand washing and social distancing and wearing face coverings, there are ways to honor mom that do not pose a risk for disease transmission. Schedule an online Mother's Day call, FaceTime, Zoom, or just a telephone call. Send a gift. Make mom a video with Happy Mother's Day messages from all the children and grandchildren. If the weather is nice and you have plenty of outdoor space, you can see your mother. But again, keeping social distancing in mind and face coverings. Mother's Day won't look quite the same as it has in the past, but it's important that we protect our mothers, protect our family. I want to say a special Happy Mother's Day to my mother. She's 89. Haven't seen her in over 2 months now, she reminded me, but she understands clearly the need for this, and we're looking forward to seeing her at some time in the future. But Happy Mother's Day to you, to all you mothers out there, and we thank everyone for protecting your family and your mother. So that's all I have. Kathy?
Sure. I will say Happy Mother's Day to my mom as well, and I'm hoping that my kids listen to your list of things that they can do with me this weekend. I wanted to speak a little bit about the African American data that we've been looking at and are going to be getting up and visible here. I think it's really important with this pandemic that we look at subpopulations, and now that we have more information and more data, that we have the ability to start to look at that and do that. So we know that that overall we have had 95 individuals who are African American out of the 10 individuals that have had COVID-19 in the state so far, and that the percent of African Americans is higher than their percent in the population overall. So we have had overall statewide 7.3% of our cases have been African American, while only 4.2% of our population is African American. We've had 13 counties that have had at least one case in the African American population, and we will be posting the African American data by county today by 5 on the dashboard with that. If we look at counties with more than one case of COVID-19 in the African American population, we actually have several for which the counties have a higher percent of cases among African American than their population of African American is. And those counties include Berkeley, Jefferson, Marion, McDowell, Mercer, Monongalia, and Putnam. Again, some of those are small numbers, but we think it's important to look at that to explore further and to work with these populations. We've got many counties that are reaching out to our African American population, and more I think that we hope will continue to do so. In addition, we have been working closely with Jill Epson and others on getting the commission, the advisory commission up and running, and we've reached out to the individuals for that. She's been working with us on that and getting a meeting set up for early next week. And we really look forward to being able to share some additional data with them and as we plan forward together. Thanks.
All right, thank you both. Dr. Clay Marsh, our coronavirus czar, is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. West Virginia University is preparing to announce a major furlough of employees. I think that they're expecting somewhere between 800 and 900 employees over the weekend with plans of bringing them back, hopefully the summer, depending on how things work out. I wanted to get your thoughts on that, Governor. Obviously, that's the largest university in the state, but I'm sure other universities and colleges in the state are probably not too far behind that. So I just wanted to get your take on those announcements. Thank you.
Stephen, we're really just waiting on guidelines and rules. I mean, I could give you a doom and gloom scenario. The doom and gloom scenario would be, as simple as this. They come out with rules from the federal government that we can't use dollars for backfilling. We can't use dollars for hardly anything, And if that be the case, then we're going to have to really clamp down and probably lay people off and do the things that are, just terrible to do. On the other hand, I don't believe that. I don't believe that's going to happen. I believe what's going to happen is our revenue people are going to find ways and everything that we can absolutely keep these people, whole and keep moving forward and bridge ourselves to being able to get back to work. As far as WVU, I don't know the specifics about that, but we have significant dollars, that we know are going to flow to the higher ed community and, from the federal government as well. I know that today there's like 25, universities across the state where, attorneys are basically suing, on the behalf of kids that said they didn't get the benefits of being together or being in a dorm or wherever it may be, or going to the gyms or whatever, and the fees that were charged to them for tuition, they didn't get the benefit of being together and the education there. There's all kinds of things that, that we are still unanswered. And as we continue to go forward and everything, we just try to knock them down with the rules and the guidelines that we get. And so, as we keep going forward, that's all I know I can tell you. We've got to get the rules and the guidelines from the federal government in regard to different things we can do. I'll be meeting again this afternoon with our revenue people and everything. There's certain things that we've already got guidelines that we'll be able to take care of, and we'll be taking care of them immediately. So I know it's not exactly the pinpoint answer that I want to be able to give you, but I can't give you that until I get the rules. And so, or get all the rules and that I feel like are coming. And I think once we see everything as it unfolds, I hope and pray that we'll be able to see our universities thriving and our schools thriving, and as well as our state.
All right, thank you, Steve. Next, we'll go to Annie Moore with WVVA.
Hey, Governor, it's Annie with WVVA. If a daycare does have a positive test, what is the protocol for closing and then reopening?
Closing and reopening, and I didn't get the first part, Annie, I'm sorry.
So if a daycare does have a positive test among a worker or one of the children that go there, what's the policy for closing and then reopening?
Okay, I can answer that, but I think our people, Dr. Marsh or Dr. Schlemp or Secretary Krause can answer it better. So maybe you guys have that.
I can speak to some of that. In situations where we've had positives, what happened is the facilities have closed themselves for cleaning, and then they initiate work with the health department to see if there needs to be what further action needs to be taken. So we had a call yesterday with all the daycare center providers related to guidance around outbreak management in these settings. And this would not necessarily be an outbreak with identifying a single case with that, but what would you do if we saw further spread? And so in that situation, there's guidance that we got their input on yesterday and shared with them, and we'll continue to work to refine that to make it practical and effective for them.
All right, thank you, Annie. Next, we'll go to David Beard with the Dominion Post.
Hi. My question is inspired by an article that was brought to my attention in the New York Times, and it has to do with when we as we continue to expand testing. Nebraska is trying something called group testing. where they'll pull 10 samples, for example, into a single test, and allows you to test more, do more testing, but you only retest if one group has a positive. It has its pros and cons depending on the percentage of the virus in the population. But I wonder if that's something that you've been monitoring to see how that works, and if it's something to be considered for West Virginia. Thanks.
Well, let me jump in, and then I want Clay to come back in on this, because Clay knows this way better than I. But just think of the math. You know, I mean, I think what they're doing is just as simple as this. If they combine 10, 10, 10, and 10, maybe they can move faster. And then if one of the 10 comes up a positive and everything, you know, that they have any kind of positive in that 10, then they can go back to the 10 and find out exactly which one, and test them individually. So, you know, mathematically it makes some sense. But I think we're moving, you know, and having the ability to move forward with testing to where we really don't have to basically cluster in order to be able to move forward. But Dr. Marsh, if you can answer, please.
Yeah, David, thank you. I think that there's many ways strategically to test. Ultimately, that is a way to try to amplify the numbers. You know, our hope is to continue to expand testing and not only look at populations with really low incidence, sort of the general population, but really continue to strategically move forward. And as we've talked about before, you know, West Virginia is the first state to test all nursing home residents and staff. You know, we're now looking at assisted living. We've looked at veterans' homes. We're starting to look at other congregate and vulnerable populations and look in parts of the state that have more activity, so that we not only get the sort of the ability to look at big groups of people, but we want to look more specifically, because we've talked about a value called the R0 value, which is the reproductive score that we've talked about, how many people who are infected with a virus can infect another. Today, our R0 across the state is 0.85, which is a bit down from yesterday, which was 0.89. Whether that's really statistically different or not, you could argue. But we want to see the trend come down. It was 0.74, 0.76 went up, and now it's coming down. What we're hoping is to take the testing that we're doing, both the positives and negatives at the individual level in counties, and start to be able to derive R0 values at the county level. So it actually gives us a feel for what's going on, not only at the whole state in aggregate, but what's going on at the county levels too. So for that kind of assessment, we really want the results at the individual levels. So our initial sort of push is going to be at the individual level. But I think as we go sort of expanding testing and that way, or even having some people who might do their own swabs and then send that in. University of California, San Diego is starting to do that too. Self-testing. So ways that we can augment and accelerate building our knowledge of who's positive and who's negative.
All right, thank you, David. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I want to ask a couple questions about an article I read in the Register Herald by Steve Keenan. I hope I said that right, with the Fayette Tribune. Cases in Fayette County, there was a small spike in the cases at the hospital, at Montgomery Hospital. And I'm wondering about that county guidance for hotspots. Also in the article, it goes on to say that they're recommending gatherings over 25 not happen until after July 1st. So I wanted to talk about your surveillance of counties and hotspots and what you're doing specifically in Fayette, but then for all the counties to kind of keep an eye.
Okay, I think Secretary Crouch, you start if you would, please, and then we can flow to our docs if we need to.
Yes, thank you, Governor. Actually, Kathy has more information on the Fayette County situation, more current information. So we'll let her answer that, if that's all right.
Yes, we're down in Fayette County yesterday and are working with them actively as they are exploring what's happening currently there. And then that will feed into, I think, the designation status and the assessment status that we're moving into. That is being developed and ready to go. We are happy to explain that on Monday, as I understand, is the time that they wanted us to do that, and we will be able to share more information with you then. But yes, we're actively working with Fayette, and they are great partners to work with.
All right, thank you, Amanda. Next, we'll go to Kenny Bass, WCHS.
Thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. A question on the food chain and the food supply, and I'd kind of like to get Governor Justice to give me his thoughts on the overview of this. There were some cases reported in the Eastern Panhandle and poultry processing plant, and that's a big industry there. And obviously, with people seeing some empty meat cases because of what's going on nationally, what are your thoughts about protecting West Virginia's role in the food supply chain, specifically what's going on at some of our bigger processors, and do you feel pretty confident that we've got a handle on it?
Well, Kenny, first and foremost, we've got to recognize in West Virginia we are gigantic importers of food, and so what goes on a national scene will surely materially affect us. However, the situation you're referring to about the plant, the food processing plant, the Pilgrim's Pride plant, and everything. The National Guard is on the way there now, and so we're going to do some extensive testing there and try to nip that in the bud and stop it as fast as we possibly can in order to be able to keep that plant moving and all happening there as it should. I just only caution everyone just on this, that as we move forward, it's just as simple as this, is if we don't move forward, we could awaken to just what you're talking about, real food shortages. Do I think there's going to be food shortages? Absolutely not. So don't anyone take what I'm saying and misconstrue it. Absolutely, I do not think we're going to have food shortages in any way in West Virginia, provided that our nation continues to move forward and absolutely, we are able to manage this terrible disease until we get to that bridge drug that I've talked about so many times. But West Virginia is a big importer of food, and we've got to watch and keep our eye on what's going on in the nation.
All right, thank you, Kenny. Next, we'll go to Rodney Lamp with WBOY.
Hi, Rodney Lamp, WBOY. Governor Justice, you mentioned earlier this week the formation of a task force related to the Black population in the state. Can you give us an update on the status of that and offer more of an idea of what you want the task force to accomplish and on what time frame?
Yeah, I think Secretary Crouch has got all the data on that, and if you could hear from him, please.
Absolutely. Thank you, Rodney. Good question. We have that task force formed. The members have been contacted. We're working to set up a meeting with the task force on Monday. We're looking forward to having some assistance with regard to outreach and education. We're preparing information. Dr. Slimp provided some of the information earlier. We've been trying to get that on the website. We're going to send that to the task force members. So we're moving forward with that quickly here to see if we can get input from them, and we appreciate all their help and the members who are on there that have agreed to do that. Thank you.
All right, thank you, Rodney. Next, we'll go to Paul Mullen with WCBC Radio.
Good afternoon, everyone. A question for Secretary Crouch. I've gone to the website, and the list of nursing homes has a total of 17 on it right now. When will that site include all of the nursing homes in West Virginia? Is there a goal, and have you gotten all the testing back yet?
Yes, thank you for the question. We should have all of the testing back. We're still compiling that. I think there may be a few tests still outstanding. We had hoped to have that this week. As we've reported in the past, some of our partners out there in terms of the labs are a little slow getting information back. We hope to have that online. That information on the website, we're going to add all of the nursing homes in the state on there. There are 123. That particular slide is simply those nursing homes that have had positive COVID positive cases. So that's led to a little bit of confusion in terms of where all of the others are. The others have not had positive staff or positive patients, but we're going to add everyone on there and see if we can provide a little bit more information. Adding to the website and making those changes, our staff has done a tremendous job in trying to keep up with that, but it still takes a little time sometimes to get that information prepared so that it will go on the website and be understandable for everyone. So we're working hard on doing that.
All right, thank you, Paul. Next, we'll go to Anna Saunders with WOAY.
Hi, Governor. It's Anna with WOAY. You talked about the Hatfield-McCoy trails, but can we expect a similar update soon for rafting season? Because I know we've gotten a lot of concern here in Fayette County, not just economically, but of course public concern about out-of-state guests, especially as Fayette County cases have gone from 7 to 30 in the past 2 weeks.
Well, all I can tell you is we're watching it. We're trying to move forward as cautiously as we possibly can. You know, there's no perfect solution here. There's no point in me telling you that. The last thing I'm going to ever do is tell you anything except the truth. You know, you can see the whole group of people that's around me, and then you can't see all of their disciples that are out in all kinds of different areas. You can't see, you know, all of our interactions with the federal government. You can't see all the interactions with the experts, whether they be at universities or they be at hospitals like Johns Hopkins or whatever. You know, you can't see all of that that's going on. If you could see it all, you would probably feel more comforted and everything. However, you would also know that there's no perfect answer here. There's no perfect answer to a pandemic that no one has ever seen before. And absolutely, you know, we know the downside of doing nothing. We know the downside of doing too much. And what we're trying to do is hit the bullseye, but do it in a way of absolutely moving proactively, but moving in baby steps. And that's what we're trying to do. And that's what we're going to continue to do. I was on a national radio show just a little bit ago with Brian Kilmeade, and he was talking a whole lot about what had happened in New York. Well, what happened in New York was just one thing. New York got caught in a situation that they had not acted, and they had not acted proactively, and then all of a sudden they're in the middle of a firestorm like they can't stop. You know, we didn't do that. You know, if you'll just think back about what we did. You know, we first closed the nursing homes to visitation. The next thing, we closed our schools. We absolutely tested all of our nursing homes. Now we're testing all the assisted living. We're moving really slowly compared to a lot of other states and everything. But yet our numbers would tell us, you don't have to do that, West Virginia. You can just open the whole state tomorrow and everything. Your numbers are so good, just open the whole state. No way we're doing that. We're not doing that. We're going to go slow enough that we protect our people to the very, very best of all of our abilities. And that's what we're doing. We're going absolute baby steps, and we're going to continue to do that and everything. And as we continue to move forward, if our numbers and everything, you know, allow us to move, we're going to keep moving, but only in baby steps.
All right, thank you, Anna. Next, let's go to Charles Young with WV News.
This is Charles Young with WV News. Governor, this kind of follows up on what Anna just asked and your answers there. But earlier this week, you know, you and other officials indicated we were slowing down the aggressiveness of the reopening plan. The other day, you indicated that we were at least a few weeks out from sending government workers back to their offices. But we proceeded with the Hatfield-McCoy Trail, and you said we're going to have week 4 guidance. Can you give us a little bit of insight into what will be in that week 4 guidance? What businesses are we considering for week 4?
Charles, I think it's premature for us to get into, you know, the businesses or the week 4 guidance, but you can rest assured that everybody's working on it and working on it, as diligently as we possibly can. The other thing is just this, Charles, what we're going to do in regard to businesses and or absolutely state employees is as many as we can, as we move back into a halfway normal situation, as many as we can, we want them to be able to work from home. And that's what we want people to do all across the state. Really and truly, if we can just make it, and that is make it on both ends. Make it on the end of the protection of our people and everything and the sickness, and make it on the end of the economics for another, and it may be 3 or 4 months, but it may only be 2 or 3 months and everything. But I really believe within a 4-month window, we're going to have a drug that really slows this thing down. And then I think probably 4 months after that, we're going to have a vaccine. So that's the window we've got to watch here. This nation cannot afford, if you'll watch the unemployment rate, we're rivaling the Depression right now, if not exceeding it. But this nation cannot absorb, 4 months of still more shutdown, because if that happens, we'll spin into something that will be much, much worse than the disease. And so it's tough. It's tough stuff. You've got to figure it out. And that's why we're trying to just take those baby steps.
All right. Thank you, Charles. We have time for one more. We'll go to Ryan Quinn with the Charleston Gazette-Mail.
Hey, there are 4 kids that DHHR sent out of state for some reason. They are foster children or abuse or neglect cases or committed delinquency offenses or status offenses. And they've tested positive for COVID-19. I can't tell because the judicial branch and DHHR are giving me different reasons for them being out of state. Can you tell me why these kids were out of state? And if they were out of state for committed offenses, were they truant or something else? When did the state learn about their positive tests? And have they been included in DHHR's numbers it reports every day? And why wasn't this previously revealed? And what is being done to keep our kids in DHHR and Bureau for Juvenile Services custody safe?
Secretary Crouch, you've got to answer all this and everything. I think you'll have the answer a lot better than I.
Yes, sir, Governor. Yes, this is Bill Crouch. We are aware of those 4 children. Of course, the reasons they're out of state vary depending upon their needs. We have some children who we are not able to place in West Virginia. The COVID positive test, we were notified immediately from the facilities that they were in. So we were aware of that. Those children are safe. Those children have been quarantined. We cannot provide, because of confidentiality, specific information on these children, even the state they were in or the facility they were in. That is confidential. We protect our children and the confidentiality of our children. But please understand that we are in contact with those facilities. We know what's going on with our children. We send people to visit those children. Our staff go to visit those children and make sure everything is operating correctly. So we are aware of that, but we can't provide information because of confidentiality requirements.
All right. Thank you, Ron. Governor, I'll turn it back to you.
Okay, I'd like to comment just 1 second on the great work that our Commissioner of Agriculture, Kent Leonhardt, and all of his people do. One of the questions was about the food supply to West Virginia. Our farmers markets and our livestock markets are continuing to be open, and we will encourage like crazy our growers to grow more wonderful produce and everything to where West Virginians can buy. And so I commend, like I said, Commissioner Leonhardt and everything and all the great work that they're doing in the ag side. I also would say just this, that the more and more on the ag side that we can do in West Virginia, the better off we are and everything. I think there's absolute economic opportunities there for us from job growth and just the pure economic dollars that we can generate within products that we can produce in West Virginia, and everyone's working on that, but this pandemic has got everybody preoccupied at the moment, but I really believe that there's real opportunity there in West Virginia. So I'd end by just saying this, unless there's something that comes up, and if there's anything that comes up that is urgent in any way, you'll see me over the weekend. Everybody continues to work over the weekend. I've said it over and over. We don't rest until this thing's over, and no one's going to do that. But nevertheless, I ask you as West Virginians to keep on doing the great stuff you're already doing. We're going to try to keep moving ourselves forward and giving you a little more freedoms and bring back things to a little bit more of a normalcy, that we possibly can. But through all that, we want so much to be able to just stay the course as best we can. And so West Virginians, please do that. And lastly, but surely not least, I want to say this, and I wish to goodness that I could be with her and hug her in every way, and I'm sure my wife Kathy the same. But we've both lost. Kathy and I both have lost our moms, and so just please take time in some way, somehow. Whether it be a phone call or video call or maybe the opportunity to be with your mom, but thank them, because there'll be a day when your mom will be gone, and so I'm confident as I can be that I'll see my mom again and Kathy hers someday in heaven, and but at the same time, I wish to goodness they were here. I say this story a lot, but in growing up, a lot of times, if you were playing watching your kids play, a little league baseball game or whatever, and the sun would be hot and the bleachers would be hard, and then you think back. And from the standpoint of, kind of a role reversal, I would have been playing and my mom would have been sitting, but I've been sitting and watching my children play. And that moment of that bleacher hard or the sun hot, what you would give to have that moment back. And so once they're gone, you can't have that moment back. So please take time to embrace your moms in some way, whether it be a phone call or whatever it may be, and celebrate this great day, because our moms are so special. So happy Mother's Day to everybody. Thank you.